Why would my doctor order a thyroid ultrasound? Imagine your doctor is trying to get a clear picture of what's happening inside your neck. A thyroid ultrasound is a safe, non-invasive way to do just that. It uses sound waves to create detailed images of your thyroid gland, which sits at the base of your neck. This test is often ordered when there's suspicion or evidence of abnormalities like lumps, swelling, or other changes in the thyroid structure. It helps your doctor see what's going on without exposing you to radiation. One common reason for ordering a thyroid ultrasound is if your doctor feels a lump or nodule during a physical exam. Sometimes, these nodules are too small to be felt clearly, so the ultrasound provides a more detailed look. It measures the size of the nodule, checks its internal composition, and assesses blood flow within it. This information helps determine whether the nodule looks benign or suspicious for cancer. Ultrasound features such as irregular borders, microcalcifications, or increased blood flow can raise concern and may lead to further testing like a biopsy. The ultrasound also helps distinguish thyroid nodules from other neck masses, such as swollen lymph nodes or cysts. It can identify diffuse changes in the thyroid tissue, which might happen in conditions like thyroiditis or autoimmune diseases such as Hashimoto's thyroiditis. If a person has had thyroid surgery or radiation exposure, ultrasound can be used to check for residual or recurrent tumors or to see if cancer has spread to nearby lymph nodes. In some cases, people with a family history of thyroid cancer or genetic conditions like multiple endocrine neoplasia may undergo ultrasound screening to catch issues early. It's also useful for guiding procedures like fine needle aspiration biopsies, where a small needle is used to collect tissue samples from a nodule. Ultrasound guidance makes these procedures safer and more accurate. It's important to note that ultrasound does not evaluate how well your thyroid is working. To assess thyroid function, blood tests measuring hormone levels are needed. Sometimes, doctors order ultrasound based on abnormal lab results, especially if there is a visible lump or symptoms like difficulty swallowing or voice changes. Doctors usually follow established guidelines when deciding to order a thyroid ultrasound. They consider symptoms, physical exam findings, and lab results. For example, if you have a palpable nodule or a large goiter, an ultrasound is often recommended. Sometimes, ultrasounds are ordered incidentally when imaging is done for other reasons, which can reveal nodules that might not be causing any problems. In summary, a thyroid ultrasound is a key tool in diagnosing and managing thyroid conditions. It helps identify and characterize nodules, guides biopsies, monitors known issues, and screens high-risk individuals. Remember, it's just one part of the overall assessment. Always consult a healthcare professional, like an endocrinologist, to interpret the results and decide on the best next steps for your health.